we will have done ourselves and our patients proud and our nation proud. So now I'm switching gears and trying to tell how do we give feedback to our student. And I think that is the way we should also give feedback to our husbands, to our children, to our servants. So it's a journey where how do you give feedback to somebody and you build partnerships so that everybody improves. So it's not just between a fellow and the teacher. So why should there be feedback from a mentor? I think my take is that I want my student to become better than me. Then only I have justified my existence as a teacher. My trainee should achieve the best potential. So they should acquire the knowledge, the skills, the attitudes and behaviors. There is no point in saying कि अगर आजकल तो बच्चे हमारी इज्जत नहीं करते हैं, आज तो वो पढ़ते ही नहीं हैं. I mean, what effort did I make to make them come up, to make them ethical, to have good behavior, attitude, so that they become the best effective healthcare providers, if not for anything else, at least to take care of me when I'm old. But here we have students who are very different. Every student is different. Their background are different. Their attitudes, behaviors are different. So how do we cater and how do we make things in such a way that we can apply these principles to everybody? And I would like everybody to read this article. This is a review article by Subhadhra and Sharon Krakow in Medical Teacher Journal, published in 2012, where they have summarized all sorts of evidence and all sorts of studies in that article, where they have given 12 points about the feedback. I'm just going to go through a few of them. First is that we must have a very respectful learning environment. We should not look down upon the other person whom we are trying to mentor, that, I am this big teacher and that person doesn't know anything. As I just now said, the residents know a lot, sometimes much more than us, and then we feel very threatened, and then we try to put them down. So it should be a very private and peaceful surrounding when we are giving the feedback, with mutual respect for each other, and it should be in a partnership to learn and share what is happening. It's a two-way process of interaction where the student should speak more, and we should be listening, and of course it requires a very good interpersonal communication skill between the student and the mentor, because they may be at different wavelengths because they're coming from different backgrounds. So at our place, once a month, 15 minutes we are sparing. It's already earmarked at LVPI. 15 minutes between each trainee and the doctor is earmarked for them to interact and give that feedback. So in spite of busy practice, busy work, 15 minutes per month, they have to sit down and have a talk with the fellow. So then, of course, we should communicate the goals and objectives for feedback. If we just two people sit there and talk without a proper format, we'll just be talking silly things. So we should set the time, agenda, and goals beforehand at the start of the fellowship, at the start of residency, that this is what is going to be your feedback and this is how it's going to happen. You inform them how your performance will be assessed and how I'm going to give you the feedback on your performance, because this requires that I'm interested in you. I want you to be the best, and it's not to stop you from going forward, but we need honesty on your side to present what is happening so that we can have a discussion and improve things. So for us, we have an annual schedule which is given at the beginning of the year. Every Saturday, every month, it is earmarked for fellow evaluation and interview. So we ask them and we show them how to maintain their logbook. I'll just show you a sample of that. The seniors also guide the juniors how this logbook is going to help you. It is not to showcase to the teacher, but it is your work. And every long-term trainee also in our institute has a non-academic mentor from another department, like a friend or a guide to whom they can go to when they are in personal or professional difficulty. So that person has nothing to do with the department. So a cornea fellow may have a oculoplasty or a microbiology person as their friend in the campus. So this is a fellow's logbook. So you can see they have done a lot of lasers date-wise, and then the person has written what difficulty that person had. So the fellow has written very honestly what was their problem while doing that laser, while they were doing it, and the mentor was there and corrected. Same way, here is a logbook for the problem. This is on the day of surgeries, 7-8 days of surgery. So in that month, what problems they had. For each patient, they will write what difficulty they had in their logbook, and then the learning points for each of them the teacher has discussed right on spot. When that problem happened, the teacher was there and explained to them what mistake you are doing, and then the fellow at the end of the case is writing down what they learned. So they have a good repertoire or a good data about what they did difficulty and how they did it better. When the new fellow comes, they can tell them, don't do this mistake, this is what I did. So there's a lot of learning and sharing between the mentor and teacher, and it's done very honestly, that what they did and how they can improve. So this feedback should be on direct observation. It should not be something that you imagine. So it is very important to be there at least in the early phase of the learning and show small things, steps, and what they're doing wrong, and they should document it. So now you can see here I'm trying to fly this kite. I don't know how to fly this kite. Now if my teacher is there looking behind and doing something else, then they're not going to teach me how to fly that kite. So it is very important that the behavior and attitude corrections should be given on actual observations than on second-hand information. If somebody says, no, that boy doesn't talk to patient well, that girl shouts at the counselor, don't give feedback on that. What you have observed, what you have seen, give on that, because it is found in research that the trainees accept and respect much more when you correct them on the behavior that you have observed. So that there's a very truthful, give and back, and rather than somebody is looking behind and giving a feedback without actually knowing what actually happened on the ground. Make the feedback really timely and a regular occurrence. This is the formative feedback that we were talking about, so that the corrections can happen side by side in the continuous learning process rather than at the end of the posting or at the end of the training when you cannot do the course correction. So at the end of any episode, if there's an acute episode, there was a big issue, then at the end of that, the two people should sit together, the teacher and the mentor, recollect all the details, both should put the things there, and then provide what did we do wrong or what did we do correct and how we could have done this. Then during the course of the posting of course, a longer session should be held, and then there should be a complete summary at the end of the posting. So Dr. Rao started this, and now it's been done by many people in my institute. At the end of the busy OPD, 70, 80, 100 cases, every faculty spends 10 minutes with the fellows and the optometrists and asks them to lay down what two good cases you saw or what two important points you picked up. So we complete that part there and then, because it is fresh, it is hot, there are queries in the mind of the resident, there was busy OPD, they didn't get the answer. So we try to answer it, it just takes another 10-15 minutes of our day. And if there's something new, what is happening at LV Prasad now is that now we have a proper assessment of the attitude and behavior of all the fellows and residents, which we collect quarterly and then discuss with the fellow in private and try to give them a feedback while they are on that. And this is also given to education department. Now this is very sensitive because we don't want any fellow to be depressed and go for suicide or things like that because of a reprimand. So this has to be done very sensitively in private between the mentor. Then we also should begin, whenever we are talking, to talk to the fellow. As I said, we should have this talk with the fellow talking more than the teacher. If we keep on saying, tumne ye nahi kiya, tumne wo nahi kiya, tum ye kharab ho. No, first listen to that person, ask what they did, commend what they did good, and then say where were the gaps, what we could have done better, and this is what we are doing. Always we are doing this in our sessions, and then we provide the guidance and not the path. So this feedback is, if the person themselves come up with that points that this is what I did wrong, that is good, because that is what you also wanted to convey to them, but they have brought it up themselves, so they feel more empowered and they are more ready to learn. So these are the 4 points which should always start with what good happened. Always say the glass is full before you say the glass is empty. So what good happened, you did this good, you were good to this patient, I was very impressed that day you worked till late. So give that positivity and give encouragement and feedback on them, and then point out the weakness and ask the person what do you think is the solution, and then agree and then give more comments. So here we also do this at our institute like that. Then there are other 6 points, I'll go through them a little fast, that make it a two-way thing. Comment on the behavioral skill and not on the person. Not saying tum gadhe ho, tum sare aise hi hote ho, tum ladkiyan to aise hi karti ho. So don't make it like personality or group wise, which is very common practice that we do both at home and outside. We should talk about the traits. We should say, this habit is wrong. So somebody asked me, do you hate smokers? So I said, my father is a chain smoker, I can't hate smokers, but yes, I hate the habit of smoking. So so how you say that you don't hate smokers, but you hate the habit of smoking. So understand the personality of the person. We get people from all sorts of backgrounds, and we've heard, people committing suicide or people getting depressed. So we should understand from where the person comes, what are their values, how they understand things, and try to learn those things. And always the session should end on a positive note. Many times in these sessions, the candidate will cry, they're very depressed, they are, crying, but at the end, they should leave on a positive note that something positive happened. So this is what is very important. When I was a retina surgeon and I was starting, there were 3-4 mentors in my hospital, and one of them, I asked, do you think I'll be a good retina surgeon? Because at that time there were no women retina surgeons, and I was not sure whether I will do. So I'm having doubt. So the person said, maybe Dr. Subhadhra, you can be a good surgeon, maybe. I was expecting he will say, of course, why not? Why you will not be a good surgeon? You will definitely be a good surgeon. You need to do this and this and this. But that person didn't say that, So it was so, like, going home I was so demoralized. Okay, will I become a good retina surgeon? I'm happy today I'm doing much better than that gentleman. So I think we should confirm the learner's understanding at the end of the session. Once we finished and they've calmed down, the emotions have calmed down, then we are understanding, because it's an emotive session for both the teacher and the student. At the end of the session, we should calm down and understand that, okay, these are the things have gone through, this is what we have understood from this session, and this is what is going to happen, and this is how we are going to change. And then, you set deadlines and conclude with an action plan that, go ahead and do this, and I will assess you again after this much time, put those timelines. So this is going to be daily, ongoing, and monthly. And then for selected candidates who are falling behind, we have additional meetings separately, give them time and, talk to them both formally and informally outside the institute. And then once you've done that, then as a teacher, I think it's very important to take 10 minutes and meditate and reflect on how did the session go. When you've done, then assess yourself, because sometimes the sessions go very well. You turn out very happy as a teacher, but sometimes they don't. Sometimes you get very frustrated, like, why did I say this? Oh my God, this person is never going to change, and I just raised my blood pressure by shouting. So sit down and meditate, and sometimes discuss the challenges with your peers, with your colleagues, learn how I could have done it better, and we can all improve by, feedback from our own self. It's very important that every institute and every place where we are situated, we should create staff development opportunities. We cannot expect that every teacher knows how to give a feedback. So sessions like this, where we can discuss, where we can learn, where we can have case scenarios, how to give good feedback, how not to give a bad feedback, and that is very important, that some improvement can happen by training of trainers like it is happening now. And last but not the least, I think the feedback giving should become a process and part of institutional culture, and it should traverse each and every activity, not only education of trainees, but research, patient care, operations, policy decisions. We should all be open to getting feedback, and even now in sessions they will put the form, please give feedback. Even a restaurant they will say, please give feedback. Ola will say give feedback. Indigo will say give feedback. So I think we should also all learn how to give feedback, how to evaluate ourselves. This will provide empowerment and opportunity to learn how to give feedbacks and how to also receive the feedbacks constructively. So I think to conclude, we should learn the science and the art of feedback. This is very important. It's all about building strong relationships. It's not about criticism and bringing somebody down in our aspiring journeys to be the best teachers. And you can see me here, having a good relationship with my student. Thank you.
Thank you, madam. That was a wonderful